cost of dental implants. So what determines the cost of implants? What are the factors that determines the cost? We saw it in the last video. Of course, if you have not checked those videos, we'll give you a link for the video. Please do watch that video. So this particular video is on the cost. So it's going to be a continuation of the previous video which we did. This is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai, Rajanamalapuram since the year 2001. If you have not yet subscribed to our channel Pearls Dentistry, please do subscribe to our channel. We are coming out with a whole bunch of videos in the next 1 year. I hope you find it useful. So when it comes to implant, so usually there is an implant which gets into the bone, and there is an abutment which is a connection between the implant and the tooth which we give on top, and of course there is a dental crown which gets jointed through the abutment to the implant. So when we look at the cost of a dental implant, so we need to of course see the cost based on whether we are just checking the implant and the implant plus abutment or implant, abutment and crown. So for ease of communication, let's look at this cost of implant as an implant plus abutment, because a crown cost might be different. So when you look at an implant cost, so the cost will depend on as I said, the country from which the implant is manufactured, the amount of original research that implant has got behind that implant particular design, what is the research that is there, what are the stringent quality control measures that the manufacturing process has undergone, and what is the kind of CE certification and US FDA approval those implant designs has got, and whether those implants are registered in our country to be sold as a medical device. So these are the different things, because it's very important, because India has got a very stringent rules, so that the implant particular company has to get registered as a medical device in our country also before we can actually place those implants. So all these things will determine the cost. So if it's going to be an implant that is there are low cost, medium cost and a higher cost options. The low cost options are typically those implants that are manufactured either as made in India or Israel made. Israel, you've got a lot of dental companies there. So they manufacture a number of dental implants. Many of those dental implants will be clones of the existing implants that are manufactured elsewhere in those world, and those implants are also being sold here in India also. So implants that are typically manufactured here will anywhere range from about 20 to 25,000 rupees will be the cost of the implant. So when I say the cost of the implant, as I said, it will include the surgery cost, it will include the placement of the implant, it will include the abutment, the cover screw and all the other things that comes with it. The cost of the crown alone will vary depending on the type of crown that we have chosen. The type of crown can be a ceramo metal one or zirconia one. So based on the crown that we have chosen, the cost of the crown will vary. So this is one kind of an implants. The second kind of implants are typically ones are either the East European made or the Korean make implants. Again, they are little better off and they are little more expensive when compared to the first set of implants. Again, so these implants can vary anywhere from 30 to 35,000 range will be those cost of these implants. So again, the cost, in addition to whatever those original research, manufacturing requirements, quality control measures and also the certification, another thing that will determine the cost here is how soon the implants can be loaded, or what is the osseointegration potential. So when I say an osseointegration potential, how fast the bone forms around those implants, when can we actually load the implants and give tooth so that the patients can chew well and eat. So this will also determine the cost of the implant. So a Korean made or an East European made implants which can be probably loaded faster or sooner will cost a little more than a locally made implant. So that's a second range of implants. Then of course you have got the next level of implants, a premium range of implant which can cost anywhere from 40 to 45,000 rupees. So these are typically either Swiss made or US made with a lot of provisions for immediate implant placement, immediate loading conditions. So they have got a lot of surface characterization which will help us to give the permanent teeth under ideal conditions to ensure that we can immediately load those implants. So these implants will cost a little more or slightly more when compared to the other two range of implants what I said. So these are the three different ranges of implants. So when I say range of implants, these are typical root form implants which are placed as implant separate and an abutment on top and the crown on top. So these is how the implants are placed. So this includes the cost of implant, abutment, and the surgery cost, and whatever additional parts that is required for the implant. So, and of course, as I said, the crowns will be costing additional. And if at all we have a bone grafting requirement, we have got some membrane requirement, so we need to grow some artificial bone, or we need to source some bone to ensure some grafting has to be done, will be usually an additional cost, which of course we have seen in the previous video. We can always have any questions, we'll be happy to answer. Do post in the comment section below, we'll get back to you with an answer. I hope you like this video. This is Dr. Arun from Pearls Dentistry. Until next time, signing off. Bye bye and thank you.
Do you like the video? Press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.